My name is Christine Musyimi. I'm a researcher at the Africa Mental Health Research and Training Foundation, and I have been doing community mental health research for the past 5 years. My research is about engaging traditional birth attendants to reduce maternal depression in rural Kenya. And this came as a result of trying to address the pressing need of a huge treatment mental health gap among pregnant women in rural areas. There has been current efforts in Kenya to change the role of traditional birth attendants from conducting deliveries to being birth assistants. And so we realized it is important for us to use that channel to be able to engage them and train them on how to provide psychosocial interventions to pregnant mothers with depression. And in the control site, traditional birth attendants were only trained to screen but not to provide psychosocial interventions. And so they could only refer a pregnant mother with depression, but also provide usual care that they normally do before they refer to the hospital. The intervention site was reported to have improved quality of life outcomes. There was a significant reduction in depressive symptoms compared to the control site. There was also improvements in quality of life outcomes, in terms of psychosocial outcomes, in terms of environmental, physical, in terms of access to mental health services, where the traditional birth attendants provided usual care. So my motivation to pick mental health among pregnant women is the need to address maternal depression not only at the individual level, but at the society level, at the family level. When you're looking at the life of a mother, you're not looking at the life of one individual, you're looking at the life of the mother herself, the life of the baby, the life of the spouse, and you're also looking at the life of the entire family. So I felt if we handle the life of a mother in terms of reduction in depressive symptoms, improvement in their quality of life, then they will be able to handle other responsibilities. If only traditional birth attendants could be embraced instead of banning them, then this would really bring a big change in the lives of communities, because pregnant mothers still seek their services. The greatest impact that I have seen among pregnant women and among traditional birth attendants, it is the possibility or the effectiveness of training traditional birth attendants to provide psychosocial interventions to pregnant women. I have seen pregnant women improving over time, and I could say again and again, we cannot significantly reduce the mental health treatment gap by targeting mental health specialists. The greatest way to reduce the huge mental health treatment gap, not only in Kenya, not only in Africa, but developing countries, is to reach out and train more lay workers who can be able to target acute mental illnesses and be able to reduce the number of hospital occupation in rehabilitation centers